For female entrepreneurs, I would say like go big. Like there's not a huge difference between going big versus going for something where you're like, it's halfway there. You may as well go big. There's no reason why a startup starting out of Sri Lanka can't be tackling a major problem that, sits across all of Southeast Asia or globally. Like, we've got the same talent and the same ambition.
Welcome to another episode of Hat, where we talk to a diverse set of entrepreneurs, investors, co-founders about how do we transform Sri Lanka from a troubled nation to a startup nation. Today, we're very fortunate to have Manuri Gunawardena, CEO and founder of HealthMatch, with us here in Sri Lanka in person. Welcome. Manuri. It's great to have you here, and thank you for agreeing to be on the podcast. I just wanted to start off with your story to just give context to kind of our podcast viewers. Because you are Sri Lankan, you come from Sri Lanka, you live in Australia for a bit, and then you founded this thing. But can you fill in the dots and just tell us how this all happened?
Yeah, absolutely. Well, thanks for having me. It's great to be here in person. I think this is my first time back in Sri Lanka in like 7 years, so I'm very excited. So I was born in Sri Lanka. My parents moved to Australia when I was, I think, 2.5. I was raised in Australia. I had a real passion for, science from a young age. My mum was a science teacher. And I went down the path of sort of medicine and getting into med school. And I particularly honed in on being interested in sort of neurosurgery and the brain cancer space. And so, I went through 5 years of med school, focused on becoming a surgeon, and that's what I wanted to do. And in my last year, I was working in a brain cancer research lab. We actually ended up running a clinical trial. It was a really interesting vaccine treatment that we were doing with Duke University. And we tried to find patients for this trial and ended up with 2 in all of Australia, which was really crazy given the context of brain cancer, and people are given like 15 months to live. So, that was my first exposure to, hey, we've got this cutting edge treatment and we're trying to find patients to validate the trial, but we can't because for some reason patients don't know about this study, and only one neurosurgeon happened to, pull patients into this trial. So that was my first exposure to the problem as such. And I had no real understanding of the world of startups, Silicon Valley, anything to do with entrepreneurship, other than really seeing that, hey, like patients struggle to find clinical trials. They have to know a particular clinician or be visiting a particular hospital site. And so I guess like over time, I reached out to a friend of mine who was a doctor turned software engineer. Kind of a rare breed. I think there was only 2 in the world, or at least in Australia, and he worked at Google. And I went and approached him and said, hey, I've come across this problem. Like, it's really challenging for patients to actually find clinical trials. We're never going to progress brain cancer research, and we're never going to move the needle unless, we can actually progress clinical trials. We should consider building something for patients. And he'd actually been approached previously by pharmaceutical companies and biotechs around solving this exact problem for them. And so that was like my first validation of, hey, there's a market beyond patients here for this problem. And he actually introduced me to the world of like health tech, and that there was this whole world out there of companies solving problems in the space, and even clinicians and doctors that had taken this path. And that's how it started. And that was about 5-6 years ago, and have been building HealthMatch ever since.
Amazing. Great journey. I guess throughout your journey, if you can kind of talk about, you mentioned there's a landscape, right? Your particular startup kind of falls in, is it preventative healthcare, or does it fall in, is there a special sector for clinical trials? And maybe if you can give the audience an idea of what the overall landscape and possibility of health tech is, so that our viewers get an idea of, okay, there's these problems are being solved today, and they're kind of categorized, but and just to give an idea of that.
Yeah, absolutely. I mean, it could fall into the category of preventative healthcare as well, but I think like interestingly, it seems niche, but clinical trials is a massive category.
It's a big business. Yeah.
And yeah, like it is big business because like when it comes to drug development, right, like the whole process takes so long. It's a huge investment, and these global pharmaceutical companies almost like VCs in themselves, rolling the dice on new treatments. And the whole system has like flaws throughout it, and beginning with even the drug discovery process and the design of trials, and then eventually like when you actually launch a trial, trying to find patients, trying to actually have a very successful trial. Like there are holes throughout the journey. For us, like what we're tackling at HealthMatch is like starting out with clinical trial recruitment and matching the right patients to the right trials, but then more broadly, moving upstream as well and trying to use like the way that we're solving this problem, which is very patient centric, and our product's always been very focused on the patient. We're getting users to be, or patients to be, advocates for themselves, and then using their data to help these companies inform the way they do drug development. So how they design their clinical trials, where they decide to set them up and launch them, and using real world kind of evidence to do that versus the traditional way in which clinical trials have been done. So yeah, we operate in the category that is clinical trials, but it is a huge category in itself.
Oh, really fascinating. I have some two full-on questions from that. One thing is, I guess, this whole idea of data and who owns the data, and you said you're very like client or customer focused, right?
Yeah.
Like, or the patient focused. Sorry. In that instance, is it the people conducting the clinical trial who owns the data, or is it the person in the study that owns the data? I'm just curious.
So the way our platform operates is like, patients are building these really in-depth profiles on themselves. So we have like over 1 million patients, but closer to over 40 million data points on these patients. And they also then have the ability and, to pull in health records if they want to, which, expands the amount of data that we have on an individual, but they own that data, it's theirs. And really like the mission, I think the North Star for HealthMatch is to be like the largest patient network where patients have these like health records essentially that they own of themselves versus like a health record that exists in a hospital system. And because they own that data, then, we use their data to match them to trials. And then over time it can be used for other things, but also when patients sign up, we kind of get the consent up front to use that data to help in the design process of a trial, which ultimately contributes to like more clinical trials fitting the population that exists versus the other way around. And so, yeah, I think from a data perspective, it's like patients own the data. They know what's happening to it. And then over time, there are more interesting layers you can add to it. But for us, like the big thing is like, there are hospital records that exist, for example, in the US with 10x the number of patients we have, right? And that's a huge magnitude. But oftentimes when pharma companies or people run analytics over this data and try and design trials or recruit, like you're working with the 97% that don't even know about clinical trials or want to be part of it. It's just it's a data point versus the actual human with intent at the end of it. And I think that's the differential here that we're really focused on, is like bringing in the patient and like empowering them to then have that interest in trials and that participation in them.
I guess the reward factor for you as an entrepreneur is if a patient actually successfully trials a product and actually sees success in that. Can you give us an idea of what percentage that is roughly, and maybe you can share a story of how that makes you feel, because I'm sure you're not only doing this for just creating a product, right? You seem you seem mission driven.
Yeah.
And just talk a bit about that.
Yeah, I mean, like that's kind of like where we started, right? In the idea of like actually being able to move the needle on treatments. And I think to date we've now placed over 40,000 patients that have been accepted into clinical trials, which is really exciting when you think about the magnitude of it. Is that's 40,000 people, whether it's in oncology trials or Alzheimer's or whatever it is, that have been able to either access new treatments or be part of like pushing forward new treatments. and that's really exciting. And I think day to day, when you're in a startup or a tech company, you're and for us particularly, we're very data driven and metrics driven, and you're looking at all your numbers of matches, applications, so on. But then sometimes taking a step back and you get a occasionally I get on the phone with patients, right, and you realize the impact of what you're doing. The other week I had one of our investors, for example, had a connection of theirs that was diagnosed with pancreatic cancer. They were looking for a trial. They'd kind of searched, had no luck, and they were just introduced to us in the platform, and we were able to actually find them a range of options, like 5 studies. 2 were in Australia, 3 were in the US. And the interesting part of this was not the fact that we found them 5 studies, but their daughter-in-law was a radiation oncologist at the hospital that we found the trial, and she didn't know it was running in that hospital. So it goes to speak to the problem that we're solving, which is an information problem.
Yeah.
And I think sometimes going back to those stories on the ground, really reminds you the point of HealthMatch and the importance of the mission.
So you also have a background of helping female or female education in STEM, right? And here at Hatch, we're very big on female entrepreneurship.
Yeah.
If what is the advice that you would give? I don't know how long you've been in Sri Lanka, but for a female entrepreneur starting today, out of Sri Lanka, what is some advice that you would give starting off?
Yeah, I mean, I kind of say my advice in general is tackle problems that you have a real affinity to and a passion for, because the journey of entrepreneurship or building a company is not easy, and naively I really underestimated it at the start. So you need to have
It's
that.
a good thing in some way.
Yeah, it is. It is a very good thing to not know what you're in for. But if you have that passion, right, it'll see you through the ups and downs. And I think that's a big thing. The other thing is generally for female entrepreneurs, I would say go big. Don't be disheartened by the type of problem. In STEM, right, there's a lot of areas that are very male dominated, and I think maybe it came from the background of me wanting to do neurosurgery, which is also very only 5% of female neurosurgeons exist. But I think taking a bet on an area where you might think is not typically common for female entrepreneurs to go into, which is why I think it's great when you see female entrepreneurs in sort of STEM categories, leading the way in things like AI or whatever it is, really. So that would be my advice, is just, pick an area that you have a real affinity for, and go big on that area.
I really like the idea of going big, because we do see a lot of female entrepreneurs here, but they tend to focus more on a lifestyle business.
Yeah.
That is something that they can manage family and this thing and kind of their lifestyle at that moment in time.
Yeah.
I'm sure you've seen this as well in your journey. What would you how would you advise those kind of entrepreneurs who are maybe doing it to as a lifestyle, but thinking about, hey, how do I turn this into something big?
Yeah.
Maybe a bit more into that.
Yeah.
Because I feel that's really relevant for here.
Yeah, I think it's a balance, right? And I think everyone at different stages of life have different sort of risk appetites. When I started HealthMatch, I was 23, didn't really have any commitments other than med school, and I kind of could shoot for the sky and see what happens. But at the same time, I think nowadays there are a lot of examples of female entrepreneurs that are going big and doing it whilst balancing other aspects of life. So the example I always use is Whitney from Bumble. She IPO'd with her 2-year-old toddler on her hip, and still goes to quarterly calls and board meetings, and really is vocal about that sort of balance of having kids, being a young female entrepreneur, and running a publicly listed company. And I think Australia has a great example. Melanie Perkins is another example of a young female entrepreneur that's built a unicorn business. And so for me, it's there are plenty of examples out there. my own personal experience, like last year I had a baby and it was a real shock to the system, like trying to run a company and be in a startup and then, enter into motherhood and balance all those aspects of life. But I think, you can do it. There's obviously trade-offs and it's a juggling act, and it does become hard when, like, especially for females, like your fertility and your career peak at the same time. But it's possible. And I think if you're really thinking about taking that leap and you're going to go into a startup anyway, like there's not a huge difference between going big, like going for something big and a big opportunity versus, going for something where you're like, it's halfway there. I feel like they're both going to be.
You may as well go
You
big.
may as well go big. They're both going to be a lot of effort. So
Amazing. Let's talk about. Okay, so I think if you know some background to Sri Lanka last year, in terms of funding, it was very limited. Just to give you some context, generally a country should have about 0.5% of GDP kind of going into risk capital, which is the startup ecosystem, etc. Last year we had roughly 0.0014%, approximately $12 million go into all startups in this thing, which is a very low number.
yeah.
What do you think, maybe representing Australia, Sri Lanka, how do you think we can bridge this gap in funding and opportunities across the two countries to create an enabling environment, which is what Hatch is trying to do. But obviously there are limitations.
Yeah, I think the hardest thing is like when you are solving just, let's say, a localized problem, it becomes hard, right, for funding, where you've got international VCs outside of I guess Sri Lankan investors. And the question's always going to be like, what markets are you operating in? Why would I invest here versus there? And I think the way to sort of tackle this and enable, I guess, more and more startups to come out of Sri Lanka with that funding and ability to go global is to tackle those, like, and I keep coming back to this, is like to tackle those big problems, because there's no reason why a startup starting out of Sri Lanka can't be tackling a major problem that, sits across all of Southeast Asia or globally. Like, we've got the same talent and the same sort of ambitions. And so I think that's probably the first step. And then the second step is then opening up that talent pool of founders to more sort of global investors and investors that, can then see those opportunities that are available. And I think, as more and more of like, this generation has access to like the internet and sees what's out there in terms of like other founders and other markets, like I think it's just very exciting what the future holds. And I think I was hearing about some of the initiatives that Hatch is already doing to allow, Sri Lankan founders to tap into more global capital sources. And I think, the going big aspect of it will help.
We're definitely trying to take advice on going big.
Yeah.
So I think one of the other questions I have really was, you moved from a field that you were very comfortable in to something that you weren't so sure about.
Yep.
Right? For the first time. How did you manage that? How do you? Sometimes the people say you fake it till you make it, kind of thing.
Yeah.
How did you feel? How do you tackle that? How did you manage that entire thing?
Yeah, I think like there's definitely a lot of that. We spoke about imposter syndrome before. There's a lot of that. I think.
And go to the story of Tyrannos, is it?
Elizabeth Holmes didn't really help the cause for female entrepreneurs in healthcare.
Yeah.
But I think the biggest thing for me is like just having that appetite for learning and like, absorbing information. So like early days, like, like you read through all the classics, like Hard Thing About Hard Things and 0 to 1 and all the like, entrepreneurs or people who've done it before that had like, podcasts, books, whatever it was. Like I used that as my sort of individual learning. And then I also tapped into like a network of mentors and people that had experience and done things before, and somehow found my way like to those people to get advice. And that was really helpful. But then I look back at the journey and I look back at like my understanding of these concepts at the time, and I just go, oh my god, like how did you somehow manage to like get through to the next hurdle? But I think that really speaks to like you don't necessarily need to have all the expertise, but I think you need to have a mindset around growth and learning, which will enable that.
Top three books of yours, have your favorite top three books
Oh
that got
yeah.
you through.
Well, I've already mentioned it. So the hard thing about hard things, I love. I like. There's a book called is it Outliers or Originals? Malcolm Gladwell.
Outliers, yeah.
Outliers. Not necessarily startup related,
Mm-hmm.
but it was kind of motivational.
Ten
And
thousand hours of practice.
yes,
Okay.
yeah. And the other one I would say that I've gone back to a few times. I'm Peter Thiel might be controversial, but I quite enjoyed Zero to One
Yeah,
because
yeah.
it was a great, like, I think I read that at the very start of the journey. And that was a good sort of like examination of like, how people think and how you actually do take those big bets.
Yeah, absolutely. Let's talk about another interesting aspect in what you're doing. I think the field of genomics.
Yeah.
And I find it fascinating. I don't know if you've seen the movie Gattaca.
Yeah.
Okay. The whole idea of designer babies. What is your moral take on it, or ethical take on it? Is it an A or a yay?
Um, it's a hard one because I think like designer babies or sort of like, the field of genomics and is that you can improve a lot of things around like, pre-existing illnesses or kind of like screening for that. So you prevent it in the future. So that's like I think a positive take on it. I think there's like a line and you start to push that line and then we have like the human race playing God essentially, which has like implications. And I think, the like second, third order implications of that is like probably not generally positive. So I think like the thing with medicine and like all the amazing technology that's coming out of it is that we can really improve. I think the biggest thing is like improving quality of life for more and more people, and that's a real positive. But yeah, just picking the eye color of your child like that. I don't know. Some of the superficial benefits of it are just like, I don't necessarily know what the second, third order effects would be, but I don't think they'd be that great.
Yeah, I think the scary part is you don't know the ecological effects or what happens after you kind of do that, right? Like, how does that play in ecology? How does that play in the world? So that's the unknown part, which I feel it's very difficult to test.
Yes. Yeah.
Which, by the way, could be an interesting one for you to build, like a testing. If you what
A
happens.
clinical trial around people that are, maybe.
But I guess what I was going to ask is, if you could do that, right? I think the moral implications that if I was to have a child, and I'm not giving them the best chance at survival, in the sense that, okay, if there's a gene that I don't know, if there's a gene that particularly looks at, say, um, some kind of disease that's there, and I'm able to take it away. I guess is that really a question that we should be asking, or do you think it's a no-brainer? We should say yes, and we should take away that particular gene.
Yeah, I think, almost everything, and this is getting really philosophical, but it's almost like everything we do as humans is like to improve our quality of life. And I think having the ability to do that is great. And then it becomes a question of like access to that ability and, how many people get that and all of those factors. But I don't think there's a necessary downside to doing that. And yeah, it's just like eventually you get to a point where it's like we're living like a great quality of life, but then, I think one of the questions that comes up is like if you look at today versus like 50 years ago. We have like so many resources at our disposal, and generally most people live a good quality of life. But does that equate to all the other things like happiness and stuff? But we won't go into that. But I think it is a good thing to be able to improve quality of life.
It's interesting that you bought quality of life, because when you put a Sri Lankan founder versus a founder in any other country, I feel the quality like of life here might be at a lower level, and sometimes you were talking about go big,
Yeah.
but for them maybe going big is just getting that steady income
Yeah.
at a first step, right? How would you like get them to break that mindset of obviously, you know, um, it's easier when you're in a position of privilege to say, okay, anything is possible,
Yeah.
right? But if Hatch and all of us as ecosystem players were to try and break that mindset of getting someone in that context to kind of break and say, and anything is possible.
Yeah.
How would you suggest we do that? And I'm not asking for like a golden answer. I'm just saying, what do you think are the small steps we can do to kind of get there?
Yeah, and I think that's a great point, right? Because it's like when you do come from a place of privilege, you have more opportunity to take risks, and like for me, it's like my parents immigrated to Australia, so being able to like get to a position like where I got into med school and I had this like stable sort of career ahead of me, like that was like fantastic. My mom's like, okay, I've done my job, like this is all worth it. And then to take that risk is like, okay, where you'll land then is questionable. But then you come to Sri Lanka, right? And people might be at a different scale, like trying to throw up like the type of risk that they can take. And I think the best thing to do is almost give some sort of safety net, like for people to take those bets. And what I mean by that is like having spaces like this, having incubators, having accelerators, having places where people can take gambles, and then like the opportunity sort of cost of that isn't as high. And I think the more and more examples of other entrepreneurs within Sri Lanka who've done that and then gone on to the next step, and people can kind of look at that and say, hey, you know what, I'm going to give this a year, and if it doesn't land, I'll do something else, or I'm going to do this while I'm also working on, something in the meantime. So I think it's just like the more and more of those opportunities that are available will help.
Okay. I think I heard your story and you said like one of the first people that really enabled you were mentors, right? I hope that we can get you to be a mentor to some female entrepreneurs in Sri Lanka,
Yeah.
and really bridge the gaps between Sri Lanka and Australia. But other than being a mentor, do you see anything else that we can do to bridge gaps between the two countries, and maybe the opportunities and having business go between the two countries, etc. as well?
Yeah, I think mentorship is super important. Any sort of like expats or people that can come back and contribute to helping sort of build the ecosystem and help it thrive. I think the other aspect is like tapping into sort of the rest of the community, and in Australia, for example, showcasing Sri Lanka as a startup ecosystem. So whether it be for investors or talent, you know, putting it on the map and saying that it exists and that it's here. Because I think, even for myself, like up until recently, I didn't really know that there was an ecosystem here, and that there were so many like amazing entrepreneurs doing really cool things. Like just making it more visible will really help. And then, bringing in sort of resources outside of just expats that or like exports that can help contribute to the ecosystem.
Thank you very much, Manuri. Manuri, it's been an absolute pleasure to have you with us.
Thanks for having me.
And we really look forward to continue working with you throughout our journey. And definitely, I think the big takeaway is go big. And we hope
Yes,
to go big with you.
absolutely. Thanks so
Thank
much.
you, Manuri.